Bonjour, on est le 24 mars. Merci d'être venu à la conférence de presse de l'ONU-SIDA. Donc, on va voir des remarques de Winnie Byanyima, qui est la directrice exécutive de l'ONU-SIDA. This is our executive director from UNAIDS. She will be giving remarks, and then we will take questions. Also to my left is Angeli Achrekar, who is the deputy executive director. She's also here to field your questions. Merci beaucoup. Over to you, Winnie.
Okay. Thank you. Bonjour, good afternoon, good morning, wherever you are, members of the press. Thank you for coming. I'm here together with my colleague, Deputy Executive Director Angeli Achrekar, and of course, Charlotte, thank you for moderating. When I just taken up my role as the head of UNAIDS, that was in 2019, one of the first things I did was to visit Kenya. There I met a woman called Juliana Atieno. She had been diagnosed with HIV as a teenager. She had been raped when she was in high school. But she'd gone on to fight, to get on treatment, and was now working as what we call a mentor mother in the HIV language. That is someone who connects pregnant women to services, looks out in the community, encourages them to come to a clinic to get tested, to get antenatal care, and to stay on treatment until they have a baby who is free from HIV. So important is her role in the community. In Africa, where there is strong patriarchy, men dominating women, you have even violence in families when one shows up as HIV positive. There's a risk of even being thrown out of a home if you go to a clinic and find you're HIV positive. Getting your husband to also come and be tested, and that whole story, this the mentor mother does. She saves lives. She's a connector. I met her. I was so impressed by her. Now recently, I called her again because I know that the project she was working on, connecting people, pregnant women to the clinic, was funded by USAID, and I wanted to know whether she was okay. She told us that the project had received a stop work order from the United States in January, and that all the staff had been put on unpaid leave, including herself. She told us that mothers had panicked and were running to different clinics, trying to stockpile medicines, expecting them to run out. She said that she put on a plastic smile to these mothers to make them feel calm, but deep down she was herself in panic. Because, you know, Juliana, who when I met her had 2 little children, had just given birth to a baby girl 4 months earlier and was still breastfeeding. To prevent transmitting to her baby, she needed to stay on treatment herself. Wasn't sure whether she was going to be able to. She has no income. By the way, her income at that time, she told me, was $20 a month. She was not earning a salary. She was getting a stipend for doing this incredible work, life-saving work. That $20 wasn't there anymore. She lives in a little slum dwelling. She rents it. She had an unemployed husband. There she was. But she was there, still optimistic, still struggling, still expecting to survive, and also keep other mothers alive and well, saving their babies. Now, that is Kenya. Kenya is less reliant on U.S. funding than many other countries. Actually, Kenya pays for 63% of its own HIV response. But now, think about a country like Tanzania, which depends 94% of its response from external supporters, mostly from the United States. So you can see. And then, even short-term interruptions to treatment are devastating for people living with HIV. If someone skips their doses, this leads to drug resistance. This leads to a viral load increase. And this leads to infections. So, I could give you more stories. I can tell you about a guy in Uganda, just 22 years old, Emmanuel, who said that the US-funded clinic he was going to was closed, and the government advised all people who were in such clinics to report to the government-funded hospital or clinic. But he said that that's what everybody did, and so he went, he waited 6 hours in the line, and at the end of 6 hours they said they had run out of ARVs and told him to come back after 2 weeks. That's how resistance builds up. He doesn't take treatment for 2 weeks, he starts getting resistant to the drugs. So, and then gets sick, and then that's how we see deaths increasing. So this sudden withdrawal of US funding has led shutting down of many clinics, laying off of thousands of health workers. These are nurses, doctors, lab technicians, pharmacy workers, all kinds of data entries. It's a lot. And all this means that we expect to see new infections rising. UNAIDS has estimated that we may be having 2,000 new infections every day, more new infections every day. This is our prediction, our estimate. And for Africa, the closing down all of a sudden of drop-in centers for girls and young women will be disastrous, because more than 60% of new infections amongst new infections on the continent are amongst girls and young women. And many of them have been going to centers created to give them the privacy, the confidence to get what they need to prevent infection. So there we are. I could give you more examples. If you ask me later, I will give you some more examples of the evidence we are getting on the impacts, devastating impacts. We have estimated as UNAIDS that if the US assistance for HIV is not restored after the pause, as you know, the pause ends in April, and is not replaced by other funding, and we have not heard of other governments pledging to fill the gap, there will be an additional, in the next 4 years, 6.3 million AIDS-related deaths. 6.3 million more in the next 4 years. At the last count, 2023, we had 600,000 deaths globally, AIDS-related deaths. So you're talking of a 10-fold increase. We also expect an additional 8.7 million new infections. At the last count, there were 1.3 million new infections globally, 2023. You're talking of losing the gains that we have made over the last 25 years. It is very serious. Today is World TB Day. Nearly 1/3 of all deaths among people living with HIV are from TB co-infections. Very, very, very closely related. The US cuts mean that today 27 countries in Africa and Asia are experiencing shortages of staff, disruptions of diagnostics, treatment, and surveillance systems are collapsing. The door is being opened to millions more AIDS-related deaths through TB. Let me lastly talk about prevention. Prevention is actually being impacted even more than treatment. Since there was a waiver to PEPFAR, we've seen some services coming back, particularly treatment services. But challenges are there, particularly for key populations, girls and young women. These people who have been served by special services that help them to overcome stigma, discrimination, criminalization. I'm talking of LGBTQ people, sex workers, people who inject drugs, and as I said, girls and young women. Prevention services are not coming back that easily because the cuts, in addition to the cuts, there is also a pushback on rights. And people who have been experiencing discrimination, stigma, who are criminalized, are afraid to come for services to places where they might face discrimination. So we're seeing the centers that we are providing them with prevention services not reopening for fear that this might not be consistent with the new guidelines. So there we are. I want to say that it was probably the greatest, that the United States leadership has been really the greatest act of humanity in global health, just for HIV, but supporting the eradication of so many other diseases, progress against other diseases. We are so grateful for that. And we continue to count on American leadership in global health. The United States has been an incredible partner for us. UNAIDS, of course, Global Fund, working closely with their PEPFAR program. It is reasonable for the United States to want to reduce its funding over time. But the sudden withdrawal of life-saving support is having a devastating impact across countries, particularly Africa, but even in Asia and Latin America. We urge for a reconsideration and an urgent restoration of services, life-saving services. I want to be clear that we cannot claim that the way we have worked, delivered for people living with HIV and at risk has been the most efficient or the best way to use money. I think some of the criticism is valid about the strategy that has been used and how we have addressed our work. It is an opportunity to rethink and find more efficient ways of delivering life-saving support. But the suddenness, sudden withdrawal of services, I repeat, is devastating. It's going to cost many lives and needs to be reversed quickly. America also has been a leader in innovation for health technologies, for HIV. Let's also remember that America has dominated the field of innovation for HIV, whether it's diagnostics, prevention tools, treatment tools. A list of companies that have made fortunes out of working on this disease and have saved many lives. PEPFAR has saved like 26 million lives since it first came on board 20 years ago. U.S. innovations have led to a revolution in treatment. Now, we are at the cusp of another revolution in prevention. Treatment, we've brought 31 million people on treatment out of 40 million. 9 million people are not on treatment today. This amazing work has come from U.S. leadership and European leadership. But now we have new tools. One of them is called lenacapavir. I've called it a magical tool for prevention because it's proved to be 100% efficient and can be delivered as 2 injections per year. Right now, trials are going on for even delivering it as 1 injection per year. 1 injection per year. That is almost like a flu vaccine. Can you imagine 1 injection for an African girl will keep her safe? Now, if this could be rolled out ambitiously across all we could cut down new infections to close to zero. We could see the end of AIDS. This is the opportunity that must be seized to drive down new infections, to get it down to zero, and then the challenge will be getting those who are living with HIV today on treatment, staying on treatment. That is a job we already know how to do very well. Now, this is an American innovation, lenacapavir. Gilead is an American company that stands to make the profits out of this innovation. Only if the President of the United States, his administration, see the deal that it is. It is an amazing deal. President Trump likes to cut deals. He's a deal maker. So I'm making this message directly to his administration. There is a deal here. It was a Republican president who led the revolution on treatment, President Bush, who started PEPFAR in 2003 and rolled out antiretrovirals across the world. It could be President Trump, another Republican president, who leads the prevention revolution leading towards the end of AIDS. But the deal is that an American company is enabled to produce and to license generics across the regions, to produce millions and roll out this injectable to those who really need it. The new infections, they are in middle-income countries, they are in the low-income countries of the South. To roll it out to all those people who need it, to make profits for Gilead, to create good jobs for Americans, and to save lives in the South. That's the deal. And I believe that this is an opportunity not to be missed. I want now to say that this, and this is my last point, that you see, this is also the way that developing countries, particularly the low-income countries, can sustainably support their own responses. They were already on the path to progressively pay for their own responses. Many of them are on the path, and we UNAIDS have been supporting them to draw these roadmaps. Now, with a reducing load number of people living with HIV, with no new infections, now the burden, the financial burden, becomes manageable for these countries, particularly low-income countries that face many challenges for their development. So I want to stop there and take your questions, and I'm also keen to hear you on what you think of the deal that I'm putting down. Thank you so much.
Let's start with AFP, Nina.
Yeah. Thank you very much. Sorry. Can you hear me? Sorry, here. Yeah, over here. Yeah, so I just wanted to ask you, it's Nina Larson with AFP?
Yes, this is Nina from AFP.
Yeah. You mentioned the risk that there could be 6.3 million more deaths within the next 4 years at the same time as infections will be rising if the aid is not reinstated. Could you sort of see the trajectory further along? I mean, if there are more infections, and I assume that you're looking at a very large number of more deaths if going forward if the aid is not reinstated. Thank you.
Very quickly, I've mentioned the projection for 4 years. In the longer term, we see the AIDS pandemic resurging, and resurging globally, not just in the countries where now it has become concentrated. Low-income countries of Africa, but also growing amongst what we call key populations in Eastern Europe, in Latin America. We will see a resurge of this, a real surge in this disease. We'll see it come back, and we'll see people dying the way we saw them in the 90s and in the 2000s. That is the short answer to your question.
Alors, Catherine, who's the ACANU president. Catherine Fiancambon, over to you.
Yes, I'm here. Thank you. Thank you, Madam, for being here. I have, in fact, a series of questions. You spoke about an estimate of plus 2,000 infections per day. What is the rate of infections today? So we can compare. Also, you spoke about the fact that the pause ends in April. Have you already found some donors who would be ready to take it over and help you support your programs? You spoke also in the press about certain percentage of programs that have already been suspended. I think it was 43%, please correct me if I'm wrong, the percentage of programs that have already been suspended. So if you could give us the figure, share the figure, and also how many staff have already lost their jobs in Geneva and in the field because of this, excuse me? Yes, UNAIDS staff. what is the percentage or the number of UNAIDS staff who has already lost their jobs in Geneva or in the field? And my last question for the moment will be about Europe, because we've heard that young people seem to be less likely to protect themselves during sexual intercourse. So what about the risks also in Europe? And particularly you spoke about TB cause infections, and we know that I would say the heart of TB infection is in Central Europe. So what about the programs there? Thank you so much for your answers.
Europe.
Yeah, because...
What was that last question?
So my last point was that you mentioned that 1/3 of deaths are of TB cause infections. And if I'm not mistaken, the heart of infections regarding TB is particularly alive in Central Europe. And I'd like to know how your programs are able to continue their work there or have already been suspended.
Okay. Those are many questions. I hope I've tried to record them. First of all, congratulations, Catherine, on your role. It's so important that you've taken that responsibility. Then you ask about new infections and how many are they per day. At the last count, we had 1.3 million for 2023. How much does that amount to per day now?
About 3,500.
About 3,500. Thank you, Angeli. So we have 3,500. We're talking of another 2,000. So you see, you're almost doubling the new infections. Second question was about the next questions were very much around UNAIDS, if I understood them. One was about, have we found new donors to fill the U.S. gap?
Yeah, in prevention. In
prevention in countries.
I mean, no. In case United States of America, after this pause, that means from beginning May, doesn't support in another form, doesn't support financially in another form your work, your programs.
Have you UNAIDS work?
UNAIDS always. Have you already identified new donors, foundations, countries, individuals?
Well, thank you. Got your question. You're now asking about us as UNAIDS. Tell you the truth, for me, always, I come from activism. That's who I am. My focus is always about people living with HIV, my cause. People living with HIV, people at risk, and how they are being affected. And I also think about the work we do for them. Thinking about that, first, we had a budget, a core budget of $144 million in 2024. Out of that, 50 million was a contribution, very generous contribution from the United States. That's about 35% of our total core budget, the core budget. Now, that we do not know whether it will be restored for next year. We don't know. We are indeed engaging with the United States government. What's important for us is to let them understand that the role of UNAIDS complements the role of PEPFAR. We do, in the whole ecosystem of HIV, we have our specific role just like PEPFAR has its role and Global Fund has its role. Among our roles is the data role. We gather, because we have the presence on the ground in countries, we have the data role, we gather all the data that everyone uses, including PEPFAR. We also have our political role of setting the goals every 5 years, mobilizing the whole world to agree on ambitious targets and holding them accountable to them. That's our role. Without that, every country would take its own direction, set a very low bar for itself. We would not see ambition of the response. PEPFAR would not get the results from the funding of American taxpayers. So, and that's just two of the roles. We play a community role, for example. The people who are most in need, who live with HIV, are on the margins of society. They need to be connected to the planning, to the delivery of services. That's our role, to support communities of excluded people to come and get what they need to claim their rights to services and to be part of the process. That's our role, to set the policies that must be there for the money to deliver. You need some clear policies, both on the science and also on rights, to make the money work. So all these things are ours to do so that PEPFAR can do its program work. So we are engaging with the American government, and my colleague, Deputy Executive Director, leads that role to persuade the government that we are a complement, that if you put PEPFAR back, you also need UNAIDS to fit in, to plug in. That is very important. Regarding other donors, I mean, the European donors already contribute to us, make contributions to the joint program. But we've been trying from a couple of years to engage some more, and with some success, given that European countries have been reducing their aid budgets. As I talk now, some of them have indicated significant cuts because of commitments in defense and other reasons. So we are not seeing any of them promising to fill this gap. Not at all. That's the answer. What we are seeing and hoping is that they will stay the course. They will stay the course, and we continue to fight. In terms of what has been suspended, I didn't understand that question, but we are indeed in a restructuring process. We are looking at different scenarios of how we can manage to keep this important role going. But let me be clear. In looking at this, we are not trying to protect a brand. That's not me. That's not my way. I am an activist leading an activist organization. We are an advocacy body. We are looking at how to make sure that this important role we play continues to be played, so that people living with HIV, people at risk, continue getting what they truly deserve, the life-saving services, whatever way it comes, whether it comes as a smaller UNAIDS, whether it comes as a UNAIDS in partnership with somebody else, I don't know, but we are looking at many scenarios of the future, a future that could include less or even no contribution from the United States. We can't assume it. We can't assume the contribution. Now, how many staff have lost jobs? None. Not now. We are looking at these scenarios. We are in a restructuring process, but we haven't yet given anybody a pink slip, if that's a simple answer to your question. But indeed, there are going to be painful decisions to make, but these decisions are right now being considered. TB, it's true, in Eastern Europe and Central Asia, it is a big issue. I could pass that question to Angeli about what we are doing there. Can you? Thanks.
Yes, thanks, Winnie. Maybe I'll comment on and complement some of the responses that Winnie provided. First, I think it's important to note that of the 1.3 million new HIV infections that were described earlier, that's around the world. There's still, in Europe and North America, 56,000 new HIV infections as of last year. So still a significant amount of new infections that are still there. When you compare that to East and Southern Africa, for example, where there are 450,000 new infections, you can see the contrast. But again, our goal here, in order to get to the first question around the trajectory of where we're headed to end AIDS as a public health threat by 2030, the issue is that we must, as a globe, we must drive down all of those new infections and all of the AIDS deaths in order to meet that goal of ending AIDS as a public health threat by 2030. So that's why, in a context where we don't have a vaccine or a cure, where the closest thing we have is to ensure that those people living with HIV are on treatment and virally suppressed, and these new tools that our executive director mentioned, like the long-acting injectables for prevention, these new tools are absolutely critical in order to scale so that the hope and the promise of achieving the Sustainable Development